Hi everyone. Welcome to week 2 of your Introduction to HIPAA class. This week we're going to be covering part of chapter 2. We're only going to be covering up through page 41, so you'll want to make sure that you go all the way through the bottom of page 41. And on my slide deck, that means you're going to go up through slide 12. Now, the slides don't include a whole lot of detail on them this week, but I do want to kind of bring up some things for you to think about as you're going through these slides. These are just some of those questions that are going to be posed throughout the reading, and I just kind of want to talk about them with you a little bit. One of the questions that they ask is, why might someone not want their records copied and sent to their employer? And I'm sure we can all think of a lot of different reasons why you would not want your employer to have access to your healthcare records. Personally, those are my private matters, right? I don't necessarily want my employer to know what I've got going on personally. So unless those are going to directly affect my work, my employer doesn't need to know. So it just, again, it's going to just kind of depend on the situation, but that's definitely going to be a reason why someone might say, no, you don't need my information because it doesn't affect my work. What are some of those things, though, that would be included that could bias that employer against me? So in other words, if they got my records, what could they do with them that would maybe not be good for me? So what might happen, especially since so many of our employers are self-funded when it comes to insurance costs and things like that, they might look at a diagnosis that I might have as being a large cost to them somewhere down the line. So maybe I have breast cancer, and the employer sees that, and even though I'm in remission, they might think, well, if that cancer reoccurs, I'm going to be a big cost to them for a lot of different reasons. And because of that, they may use that against me, to give me a job or to keep my job, things like that. So, that's another thing that we need to kind of think about as we're looking through some of these scenarios and some of the reasons to share information. They give you several different true stories in this particular chapter. One of them was actually fairly close to where I live. I live in Illinois, and it happened at St. Elizabeth's Medical Center in Granite City, and it talks about the what the a news report that was actually publicized, and how they actually got the medical records for a patient, because she was being admitted to the hospital because she had some complications from an abortion at a clinic in the area. So, this was an obvious unlawful disclosure, and obviously, affected the patient in a negative fashion. So they talk about that. They also talk about the employment status in another true story on this one. It was a South Carolina person who actually refused to release her medical records, and she was suspended for that. So they talk a little bit about, is there, what's the debate there? Does she have to release it? And if so, what kind of information is she required to release? Or is she not required to release anything at all? And then the last story that they discuss in this particular part of or in this chapter is a gentleman who actually took his wife to the police station. She was, needed a psychiatric evaluation. They took her to one place and then they transferred her to another, and they wouldn't release that information. The hospital wouldn't. Or I take that back up. The hospital wouldn't tell him what the next hospital was that she was being transferred to. And we could argue that one back and forth too. Maybe the patient indicated that she was being abused and things like that. But maybe it would be better, more appropriate for an actual healthcare professional to make that call, and not just the hospital in general. So there's a lot of things to think about as you go through this first part of the chapter. There's also going to be some review questions that you're going to be doing this week and turning in. So as you go through all of the material, Remembering you're only going up through page 41 and slide 12. If you have any problems or questions, please make sure that you reach out to me, and have a great week.